What is the difference between inpatient and outpatient in health insurance? If you are a foreign resident in Portugal or an expat living here, you may be wondering what is the difference between inpatient and outpatient health insurance. And both can be important components of your health coverage, but they offer different benefits. Here's what you need to know about each one. Difference between inpatient and outpatient in health care. Well, outpatient cover is designed to cover the cost of consultations like with your GP, specialist appointments and tests or exams carried out at outpatient clinics. This cover also exams or treatments made in the hospital during the day, and you can go home after a couple of hours. Small surgeries like, let's say, the removal of a benign skin mole are also considered outpatient type of treatment. Inpatient cover, on the other hand, is designed to cover the cost of staying in a hospital as an inpatient, and as well any surgeries or procedures, exams that you may have while you're there. Outpatient cover generally has a lower premium than inpatient cover, and it doesn't typically involve as much time or treatment. Outpatient cover generally has a lower premium than an inpatient cover, as it doesn't typically involve as much time or treatment. However, it is important to make sure you have the right level of cover for your needs, as an outpatient cover won't cover you for stays in a hospital or more complex procedures. So if you are unsure about which level of cover is the right one for you, it's always good to speak with an insurance broker like us, like C1 Broker, who can help you understand your options. So all our contacts are here down below, and me and my team will be very happy to receive a message from you. Let's look at outpatient care more in detail. So, outpatient care refers to medical care that does not require, let's say, an overnight stay in a hospital or other healthcare facility. This type of care can include everything from a routine doctor visit to small surgeries to outpatient mental health services or substance abuse treatment. Outpatient includes everything from a simple consultation with your GP to a more complex specialist appointment or an exam. And outpatient care is generally less expensive than inpatient, and as it does not require the use of an hospital bed. Outpatient care can be provided at either a private health clinic or a hospital or a private medical practice. However, it is important to note that not all outpatient procedures are covered by health insurance. Patients should consult their insurers to determine whether their chosen outpatient procedure is covered or not. And now let's look at inpatient care in more detail. Inpatient care is any type of medical treatment, procedure, or exam that requires a person to stay in a hospital or a health clinic overnight. This can include everything from oncology treatments to a hip surgery to childbirth, or even mental health evaluations that require to stay for a couple of days in the hospital or in a clinic. Inpatient care typically involves a team of doctors and nurses and other healthcare professionals that work together to provide around-the-clock care and supervision. In some cases, patients may be discharged after a few days, and while in other situations you may need to stay for several weeks or even months in the hospital. The length of the stay. It will, of course, depend on the nature and the severity of the condition that is being treated. Regardless of the length of the stay, inpatient care, it is an important part that ensures that you as a patient, you receive the treatment you need when you need it the most. Health insurance offers different levels of coverage for inpatient and outpatient care. In general, inpatient care is more expensive than outpatient, so is typically subject to a higher yearly limit. This means that if you are expecting to need a lot of medical care in a given year, it is important to choose a plan with a high inpatient limit. On the other hand, if you are generally healthy and you only expect to need occasional outpatient care, you may be able to get by with a less expensive plan. Health insurance companies, they offer a variety of plans with different limits and outpatient and inpatient care per year. To keep premiums lower, some insurance companies offer you the possibility of including a deductible or an excess and a cost-sharing arrangement after the deductible is met, or both combined. So if you choose a deductible and a cost-sharing, your premium will be lower than it otherwise would be. If you don't know what I'm talking about, if deductibles, cost share, this is complicated for you, it's normal. It's terminology from insurance that not everyone knows. So for that, I actually have a specific video explaining what it is with examples. So I will leave here down below a link. So it's very normal that you don't know what this means. However, you need to know these things when you choose a health insurance solution, because if you choose one of them, you will be responsible for paying a share of the medical costs out of your pocket if you use a certain part of your insurance cover. So before choosing a health insurance plan, it is really important to consider your needs, the budget, and to find the best option for you. So to understand more about this theme, you can go to our website, or you can give us a call, or even request a one-to-one consultation. We are very happy to help you. So now that we have looked at the difference between inpatient and outpatient care, it is important to understand what health insurance plans offer. And most insurances will have different levels of coverage for inpatient and outpatients. So, if you have any more questions about finding the right health insurance plan in Portugal, call us at C1 Broker, send us an email. We would be very, very happy to assist you. All our contacts are here down below. My name is Susanna Vishals, and me and my team, we will be delighted to help you. So, hit as well the subscribe button and the like button to help us out with the algorithm from Google, and so we can go on doing these videos and this information type of things. Thank you. I will see you next time, and meanwhile, stay well insured.